So earlier this morning, Venerable Chuni and I watched a webinar that was hosted by the Harvard Medical School's Department of, I think, Social Medicine, something like that. I'm sorry, I forget the full name of the department. And it featured Dr. Fauci and also the founders of Partners in Health, which is a nonprofit based in Massachusetts, but works globally to resolve issues of global public health equity. So the founders are Dr. Paul Farmer and Dr. Jim Yong Kim, I believe, and the dean of Harvard Medical School is the facilitator. And I wanted to share about this. The title of the webinar is COVID-19 Reflections and Updates. It's on YouTube. I highly recommend everyone watch this because it was just so wonderful and inspiring to see three infectious disease doctors and public health workers who have been dedicated to this for decades. They've worked on so many pandemics and epidemics at the US level and the global level together. They know all the difficulties at the global level, at the local level, and they are so hopeful. I think that's the message I came away with, that these are people who have dedicated their lives to healing people and whatever it takes. And they have no sense of, I did not sense any anger or despair. Coming from people who know the science, who know all the obstacles, who have been kind of repeating the same message again and again about what works, and even if it's not being done, refusing to give up. Because it's a matter of life and death. That's why they will not give up. That just gives me so much hope and joy to see, living examples of people who are doing that with their lives. And there is really no room for despair for all of us who are not involved on the front line, Yeah, so that's just for that, watch this talk. Venerable Chuni too was reflecting on the incredible kindness of others that comes through, to know that these are people that we don't see on the front page news, but with their expertise, have just quietly been working on all these global health issues day to day. It's like super unglamorous work of tracking data, reading papers, and of course dealing with life and death situations when treating patients. And yeah, their kindness truly is keeping us alive during this time of pandemic. One thing I was really surprised to learn was that Dr. Fauci was actually was instrumental in the launch of the US president's relief efforts to bring HIV/AIDS prevention, treatment, and cures to the developing world at a time where the global medical elite did not believe it was possible to cure AIDS and HIV in the developing world, saying that it's not cost effective. Poor people don't have clocks and watches and have no conception of time, and so would not take their drugs on time. It was even said to be immoral to put resources into helping the poor. Like, what's the point, right? So that was the reigning perspective. And Dr. Fauci said, no, if it's possible for us to put our resources there and treat people, let's try it, let's do it. So the US president's relief effort package went forward, and I think has had really significant results in developing countries. And that was done in collaboration with, I think, Partners in Health and many other public health bodies. So just seeing that history of working together, I also appreciated how they have so much trust that they were asking like really hard questions of each other. So, I won't spoil it for you, but, they were asking things like, why has the situation turned out the way it has in the US with the incredible depth of medical expertise, aggressive responses to previous pandemics? What has shifted in the current situation? And despite what seemed to be cultural obstacles, right, to testing, tracing, treating, all of the doctors actually said they felt very optimistic about being able to affect a change in mindsets. So that part surprised me too. They're like, yeah, it looks like there's a lot of mistrust out there. There looks like a lot of miscommunication. But many of them, Dr. Paul Farmer especially, seem to have a lot of confidence that if you get the right people on the ground, talking about vaccination, talking about social health measures that need to still be in place, people's minds will change. It's just a matter of time. So that part I also found quite remarkable, right? Because sometimes you read the news and it's like, oh my God, it's never gonna. They were all like, look, it will be over at some point. Okay, so in the meantime, do these things that will protect life. Do not give up. Yeah. So if they're not giving up, we cannot give up either. Also, what really moved me was when the Dr. Jim Yong Kim said, any good doctor is committed to social justice. So that is at the fundamentals of medical training. You do not turn any patient away to the best of your ability. So if you are a good doctor, you will naturally move in that direction. It is part of their training. It's a matter of how to put it into practice. And I was very moved when Dr. Fauci said, just looking at how disproportionately Black and brown communities have been affected in the US, I think the numbers he stated were something like, it's 4 times more likely for a Black, brown, Latinx person to be hospitalized due to COVID than a white person. And he said, I hope that the shame of looking at the disparities of the outcomes of this pandemic will move the US towards a multi-decade commitment towards reducing these disparities in public health. He said, because the virus is going to be over in a matter of years, right? But the social disparities that affect health outcomes will not. And so that's where he's really calling for people to put their attention and to make this kind of commitment. So, that they know the work is never over. It's like, yeah, okay, you cure the biological part, but there's just so many other factors that affect healthcare outcomes. And they also talked about this whole issue of herd immunity and why this is really not a safe or viable idea to move towards without a vaccine. They said the only way to achieve herd immunity is with a vaccine. There is no way to let the virus run loose and pretend like you can protect almost 40% of the adult population that is at risk. And they pointed out that one of the major risk factors that they've been seeing is obesity. That when people are unable to breathe when they're lying down, that is going to cause death. So, there's just so many factors in play. Yeah. So, yeah, I just wanted to share that, that I felt very hopeful watching these experts talk to each other and to know that we are really, there's so many kind people working hard to support us and to keep everything going in these difficult times. And most importantly, to listen to the kinds of policies that people are promoting from the public health side and to combine that with our responsibility as citizens. So, I'm not a citizen of this country. I cannot go out and vote, but really think about the long-term public health outcomes you want to see in this country, not just for yourself, for your immediate family, but for the generations of people who are going to live here and who are going to be affected by them. And also, because of the unique position of the US, and they kept emphasizing this, the US still has a lot of global power and exercises really important leadership. So the policies that you vote for in this government at this time have a global impact. Like having someone like Dr. Fauci in place is a cause for there to be HIV/AIDS treatment in Africa and other developing countries. So it's really a dependent arising. Every vote counts. So vote for policies that support the welfare and well-being of not just this nation, but the entire world.